Hey guys, welcome back to Hope with Jonathan. I'm your host, Jonathan Trailer, and I hope you guys are having a blessed afternoon or early evening. And I really appreciate everybody for tuning in to Hope with Jonathan. I hope you guys are ready for the show tonight. We're going to be discussing our topic of the evening is going to be nurses and kidneys and the roles that they play within kidney disease, dialysis, transplant, more. And we definitely want to send a special shout out to all the nurses out there that have to deal with, the everyday duties of dealing with patients and dealing with dialysis and dealing with, kidney disease as a whole. I don't think the nurses out there get enough credit for what they do. And we definitely appreciate all the nurses out there for the dedication and hard work that they put in to help us kidney patients that definitely are in need of treatments, whether it be kidney failure, whether you've been diagnosed with kidney disease or transplant and more. I mean, just across the whole spectrum. We just definitely want to spend a special shout out to all of our nurses out there. And God bless you guys and gals out there that are doing that labor for us. It's definitely a calling and a labor of love. So we definitely appreciate all the nurses out there. And in particular, I remember when I was going through dialysis, I had a really special nurse. I'll use her first name. Her name was Ariane. And Ariane was a special nurse. She always took care of me while I was in my dialysis unit and always took after me and looked after me. Real special lady. And she made a really big impression on me while I was in dialysis. I had just came out of a near-death experience, and she was so gracious to me and treated me with so much, love and care. And if I seen her on the street, I'd give her a big old hug right now for all the care that I had. So, like I said, shout out to all the nurses. We wanted to do a show on nurses and kidneys, so we're definitely excited. I also have I have a special co-host tonight, all the way from the Clean area in Texas. I'm in Texas as well, if you didn't already know. In San Antonio area in Kerrville, Texas, in our hill country. And so Victoria West is a 3-time kidney transplant recipient. She's going to show up here in just a second. I'm going to add her on. And it's definitely exciting to have her here as a co-host with me. I actually interviewed Victoria not too long ago here on Hope with Jonathan. You can catch that interview right here on the YouTube channel. Speaking of that, guys, if you haven't already, go over and hit that subscribe button over here on YouTube. Subscribe to this channel. Make sure you hit that bell to get more great content, more interviews, and you'll receive all the notifications. Make sure you click on that subscribe and the bell button. But hey, guys, with that being said, I'm gonna go ahead and bring on Victoria, and we definitely want to send a special shout out to all of our supporters, everybody watching out there. We really appreciate it, guys. And again, guys, we're gonna bring on Victoria West. Yeah, hey Victoria, how's it going tonight?
Not bad, Jonathan. How are you doing tonight?
I'm doing pretty good, hanging in there. So enjoying this Texas weather we've been having.
That's what I was gonna say. Are you guys getting a lot of rain there?
Well, it's been pretty sunny here for the most part, but some rain creeped in earlier today, and so it was much needed around here. It's pretty dry in these parts.
Yeah, we were under tornado watch a couple nights ago and then had some storms this morning. So it's supposed to be like this for the next couple of days here, I think.
Yeah. Yeah, I recently had you on the show, a couple of months ago, and you shared your story on here?
Yes, sir. Yes, sir.
Yep. And you have an amazing story. 3-time kidney transplant recipient.
Yes, sir. Thank you so much. I really enjoyed our interview. Just getting the chance to tell my story, and for people to hear that, if I can do this, anybody can do this. I've been through a lot. I've overcome a lot, and I see people out there struggling with having to live with this disease, and just know that, I mean, honestly, I'm nobody special. If I can do it, you can do it too.
Oh, that's amazing. That's definitely amazing. Do you have any kind of like a short special story about any nurses that you've came across? Because I know you've came across many during out your ordeal with kidney disease, dialysis, transplant.
I have a couple. So I do want to give a special shout out to Alicia. She was my dialysis nurse for home hemo both times that I was on home hemo. Home hemo. She was my trainer. She was my nurse, and she's an excellent friend and just really great and caring and a wonderful person. She, I know for a fact, has her own health problems and had, raising kids, and, has a whole life on her own. And for her to just put on that strong face and help people like you and I every single day, she is amazing. And I definitely want to thank her. She's one of the reasons why I made it through dialysis. And then I don't have names, but I recently got my third transplant in January 2021, and that was done at Medical City Dallas Hospital. And there were two nurses in the dialysis unit. After I had my transplant, took a few weeks for it to wake up, and I had to continue doing dialysis in the hospital. And there were two amazing nurses that took care of me. There in the hospital in the ICU unit, because we were during COVID. So dialysis was being done in ICU.
Right.
And I just want to tell them that they are absolutely incredible. I'm sorry I don't recall their names, but the night before I was going into transplant surgery, these two women did a dialysis treatment with me, and then they prayed over me.
Oh,
They
wow.
to just pray that my transplant went well, and that it didn't take too long to wake up, and that I came out of it safely, and thank God that I did. And I had an absolutely wonderful experience. So to the two wonderful ladies who took care of me in January 2021, and I had my transplant at Medical City Dallas Hospital, thank you so much. You women are a blessing.
Yes, they truly are, and it's a special calling, I believe, on their life, and that's amazing that they prayed for you, and that's awesome when people do that, and especially in the medical, care and stuff, that they took the time out to express their faith and belief and pray with you. So that's amazing, and we want to send a shout out to everybody watching. Appreciate you, Steve Belcher. Steve, the kidney nurse, appreciate you watching, my friend. Kyle Hawkins from Toronto, Canada, KWM, Kidney Warrior merch. Facebook user, I believe that's one of my family members, cousin Talisha. So shout out to Talisha. Appreciate you for watching. Midwest Kidney Warriors in the house. Shane Blanchard, what's going on, Mr. Shane Blanchard? And we appreciate all of you, all of our supporters, for tuning in. Hope you guys will continue to be engaged. Don't be afraid to drop a comment while we're talking. We don't mind your comments and questions, and definitely get engaged, guys, tonight, and share this, guys. Get this out there. See my little guy in the corner? He's telling you to smash that share button. And then I got a guy here that's going to tell you to go ahead and go over and subscribe to our YouTube channel. But hey, guys, again, appreciate all the support. But right now, we got a really special guest to bring on this show tonight to honor. And we want her to come on and talk about what she's doing in the kidney space. And definitely excited about bringing her in. And I hope you guys will get engaged tonight. And we're going to welcome to the show Alex Rosa. And she is amazing. She is an amazing person. And I can't wait. I'm not going to tell anything about her. I want her to tell her whole story. So I hope you guys will definitely get engaged. Keep dropping comments. Go ahead and continue to smash that share button. And let's welcome to the show Alex Rosa. Alex. What's going on?
Hey, what an intro. Wow.
Yeah,
Oh my
yeah,
gosh.
yeah. I learned how to do all that from a few friends in the kidney community. So
Oh,
shout out to the Brown brothers.
oh wow. That was
Yeah.
impressive. I was like, I'm gonna have to learn how to do that for mine.
Uh, but well, hey, Alex, why don't you tell us a little bit about yourself and what you're doing in the kidney space?
In the kidney space. Yes. Yes. So my name's Alex Rosa. I'm a registered nurse from Ohio, from Northeast Ohio, up by Cleveland Way. And I've been in healthcare for, my gosh, like over 15 years now. And I started at the bottom, like I started as a nurse aide way back in the day, and I was an LPN after that, and I got my associate's degree as an RN, and then I went on and got my bachelor's. Hey there, got my bachelor's degree, and then so now I'm actually finishing up my doctorate degree in nursing right now. So I will be Dr. Rosa pretty soon, and I'm so excited about that. And I'm a teacher. I'm a nurse educator. I teach first year nursing students at our local community college. So I do that on my weekends. And during the week, I work as an ICU nurse at the bedside. And I've been doing ICU nursing, Dr. Spice. I've been doing bedside nursing for a long time now, for, oh gosh, I think maybe like 8 or so years. I've been doing pretty much mostly all ICU. And I've done in my travels, done a little bit of everything. So home care, inpatient, outpatient, hospice, a little bit of emergency, a little bit, but mostly ICU. And what else do I have going on? So I'm going to school. I've got a family. I've got 3 kids. I've got a 16-year-old, a 14-year-old, and a 4-year-old. And I'm doing all that. And within the last year, I decided to kind of start my own business. And I've always been, interested in holistic health and wellness and preventative medicine. And I had always dealt with, being overweight. I had always dealt with anxiety and depression. And I was on a lot of meds at one point, and I was having kidney problems. And then after I had my youngest, after I had my 4-year-old, I went into severe heart failure, very
Wow.
severe heart failure. And they pretty much told me, like, if you don't get your shit together, like, you're gonna die. If you try to get pregnant again, like, your next baby could die. Like, it took me to get to that point. And my kidneys were shit. My heart was not doing good. It was just bad. And I just was like, I got to get it together. So I worked really hard, and I turned I turned everything around for myself, and I did that all while raising my kids and going to school and working. And I said, if I can do it, I can teach other people how to do this. So that's what I've really kind of set out to do with my whole spice, and looking at people in a holistic lens, and teaching other healthcare professionals that are moms that are going to school, about time management and productivity and being healthy in a holistic way, and managing all the stress and everything, especially now with COVID. Everybody's just, the stress levels, and especially in healthcare, people are just at their breaking point, at the burnout point. And I'm really trying to
Sure.
share that message of emotional strength, stress management, like resilience, like we can get through this. We got to do it together. So, rallying everybody together. And so that's really a bit what I've been working on the past couple months here, is really getting this together and meeting amazing people like the both of you. I've met so many incredible people while I've been on this journey. No, seriously, I'm for real. I'm not even playing. Like, I've met so many great people, and I'm so
Oh yeah.
thankful.
Yeah. Oh, the kidney community's full of awesome people, and
Hmm.
they're like a giant family.
Yeah.
And they welcomed me and with open arms once I kind of came into the scene. Just welcomed me like a brother, for if you will. And so
Mhm.
it's definitely been amazing. But can you define what holistic means completely?
Mhm. Yeah, so holistic is looking at things in the broader sense. So we're not just kidneys, we're not just the heart. We're not just a certain type of disease. There's so many different parts of us. So when you're looking at things holistically, you're looking at the spiritual part. And I'm sure that you guys can all attest to the test that you get put to spiritually, right? When you're sick and you're in that ICU, that you're on your deathbed, like, right? It's a spiritual test. So looking at things spiritually, looking at your physical health, looking at your self-awareness and taking responsibility and that insight part, and looking at the emotional health of yourself. So how you're handling stress and how your self-worth is, and are you setting boundaries, and are you respecting yourself? Like the self-worth part is a huge part of it. So that's when we talk about looking at things holistically, looking at your spirit, looking at your mind and your body, because we know that stress and all of that impacts all of our physical health, right? And when your physical health is impacted, you're stressed out, you're wondering what are you going to do? So they're all very interconnected. So trying to look at all of those things all together is definitely, I feel like, the way to approach healthcare. I don't feel like we need to spot treat this. Let me give you a couple pills for this. Let's try this. No, you got to look at it, at all of it together if you really want to be treating people in a holistic way that's going to impact their lives for the better.
Sounds awesome. Really, sounds like a great ideal. And yeah, I mean, you're living proof that it's working. Obviously, especially if you've applied that to your lifestyle. I'm sure when you said you faced heart issues, that you had to completely change your diet and lifestyle and things like that. What changes did you make?
I've talked about this on several of the other shows that I've done, but really looking at that plant-based diet really truly is a good, just like a blanket way of eating for most people. I'm not going to say all people, because there's always those different cases, but for most people, that that plant-based whole foods diet is like the way to go. And so I had to really change how I was eating, and a lot of it was how I had grown up. So my upbringing. So like I'm Puerto Rican, so in Hispanic, upbringing, you eat certain things, right? And I'm sure with every culture, there's that thing. You eat certain things when you're growing up, and if you don't eat that way, people look at you like, what's wrong with you? So you get stuck doing that for so many years, and it just becomes second nature. Things become second nature, things become a habit, things become a routine. Not always the best routines, not always the best habits. And it took so much to break that, and it really took a lot of teamwork. So like my husband as well, he's lost over 100 some pounds. We've really worked together to make this like a true like lifestyle for us, and how we bring up our kids as well. I was overweight as a child, so was he. My kids growing up, I didn't want them to face that or to deal with like consequences that I had because I was overweight. And so we really work hard to teach them the right way. And we are kind of strict in our house. We don't got soda, we don't got juice, we don't got some of that other fun stuff. But I mean, it's just how we are, and it's just the rules of the house. So that's how we've made it. But it's definitely and you had talked about that before, and where you're shopping at in the grocery store and all that, really looking at the whole foods and the real foods. And that's really has been like the secret. That and like changing my mindset has been the other huge part of it.
Oh yeah, changing your mindset is definitely key to success with anything in life. You gotta learn how to look at things like my man Shane Blanchard with the PMA, a positive mindset, positive mental attitude. So I could definitely can understand what you're saying, because for like 41 years of my life, I ate what I wanted, did what I wanted, and that lifestyle ultimately landed me into emergency kidney failure because I was type 2 diabetic, hypertensive. And so I had to make some changes really quick once I got into that, with the emergency kidney failure. I had to go, strict and just give up a lot of stuff cold turkey. And, I had a huge wake up call in July 2019. And so acceptance was a big thing for me, and change, having a positive mindset was huge for me. And but making those changes to a healthy lifestyle was the best decision that I ever made. And eating things like vegetables and things like that, and incorporating the vegetables into my diet, because before, I was just like I've said, and many people's heard me say this, I was a cheeseburger pizza guy, and so I didn't even think about eating vegetables or salads or things like that. So it was a complete mind change. And then I'm sure Victoria maybe can chime in on that as well. Maybe she had experienced that as well.
You can see the wheels turning, right? I do have. I had kidney failure at a very young age. I was diagnosed with kidney failure at 10 years old. And at that time, I was also extremely underweight, couldn't eat. They would not even put me on a on a transplant list for the first couple of years because I had to gain weight even for my age. And most of that was because the kidney failure kept me from eating. But like you, Alex, I'm Mexican American. I grew up in a Hispanic household, and where the way to gain weight is eat tortillas and beans and rice and all these things that I'm not supposed to have. And so for, the first 5 or 6 years of me being on dialysis from 10 to 15, I didn't get to eat all those fun things, Jonathan, like pizza and cheeseburgers and things like that. I would get a special treat every now and then, like maybe, tacos or Arby's or something. But that was mainly because they needed me to gain weight, And as I got my first transplant at 15, very quickly, because I never did get to eat all those fun things, the first thing I wanted to do is go eat a whole medium cheese pizza by myself and drink a bottle of Coke. And I think that's where a lot of people who go from dialysis to transplant have trouble, is because when you're on dialysis, you do have to have a super strict diet just to maintain your phosphorus, your potassium levels, your calcium. Everything has to be maintained and can fluctuate so easily. And with the transplant, it's like, okay, you can kind of eat what you want, but you still have to be mindful of it. And I've seen a lot of people go kind of crazy and gain obscene amounts of weight after transplant. And I was one of them, because we decide we can just eat what we want. I have considered and have been told by many other people, Alex, that plant-based is really the best way to go for kidney transplant or for kidney patients in general. But I have a question for you, doing it as a wife and a mother. My husband and child, I've always cooked, the foods that I probably wasn't supposed to eat, but that they enjoyed. And so my husband and I have talked about going to, trying to eat healthier and make better choices, and, for my son as well. But, I don't know that plant-based is really an option for my husband. He's definitely a meat eater. How do you, how was it having your family and your support system make that change with you?
So it's definitely gradual, right? Because people are not going to change overnight. But the really nice thing about doing plant-based is it's not 100% plants. So it's not, you can have some meat. It's just meat is not the star attraction. So just changing how they thought about that, and just kind of like gradually shrinking down the portions of meat was kind of like the secret to like tricking them. And then every now and then it'd be like, well, we're not how there's like that meatless Monday out there. You can have whatever day of the week, just as long as you start, just trying to do it maybe like once a week or something like that. And just doing it gradually. And I just try to do like, we'll do like tacos or something, and I'll make like ground turkey. Like I usually don't use ground beef, so I'll use like ground turkey, but then I make them load up with all the other stuff for the tacos in there so that they can have that. So it kind of tricks them a little bit. So that's kind of how I do it. So, and I have them eat like salad, like all my kids will eat lettuce. So it just was something they had to get used to, because it was like, bro, I'm not making anything else to eat. So this is what you're going to eat. And so that's what they would have to have. So just kind of like tricking them into it that way. But, the thing is, you have to think about too is, you are the mom, you are you are part of that household, and they have to understand too that you have needs and you have a certain way that you're going to have to eat and a certain way that you're going to need to take care of yourself. So there comes to be a point where I talk a lot about setting boundaries and stuff and self-empowerment, and like you have to be like, this is what we're doing and we're going to do it. And if they're, your husband, he's an adult, he could do whatever he wants to do, but you got that little baby you're bringing up, and that you got to, what is right for them and what is the best for them. So really keeping that in your mind, because kids are going to ask for whatever they want and they're going to want all that bad stuff. And we got to guide them in that right direction. So what you want to eat and what you should be eating. There's no reason why they shouldn't come right along with you and enjoy that same lifestyle. And it just takes a little bit of time. Like I said, not going to happen overnight, but definitely just easing them into it. And it is a lifestyle. And that's the thing I try to push to. It's a lifestyle. It's not like you hit it and quit it. It's like for a couple weeks and then you're done. No, it's long term. So we treat it as such. It's not going to happen overnight. You do it very gradually. And then it just becomes that great new habit that you got going on is, we eat less meat now. Not a huge deal. Not the end of the world.
Awesome information. Thanks for sharing, Alex.
You're welcome. Does that help?
That did. It definitely helped to talk to someone who's actually been through it as a wife and mom, because for me, I'm just expecting that, okay, I'm going to wake up tomorrow and I'm going to stop eating meat. And that's not, like you're saying, that's not the case. And I think maybe I could start making those small changes. And, my kids used to eating, he eats McDonald's, he eats Chick-fil-A, and we try to make healthy choices. And I do try to cook more than we eat out. But even when I'm cooking, I'm so used to putting, to cooking all the stuff that my mom and my grandma cooked. And I think there's a way to maybe modify those things.
Yeah, definitely. Yeah. I'm always posting recipes where I say, like, I spice up the recipe and I kind of modify it, because it's the same thing, girl. Like that's how I learned to cook, was from my mom and her mom and from all of our relatives. And it's like, they're loading up the oil and the grease and all of this. And we can't do that. We have to like kind of update how we're preparing things. And it takes a little bit of sometimes ingenuity, and sometimes that's why I like putting the content I have out there, because I do enjoy cooking. So I do, have different ways to prepare things. So, but like I will, I'll make rice, girl. I'll make rice and beans every once in a while, but not how I grew up, where it was like every single day you were eating rice.
Every single meal with rice and beans and tortillas. Yeah.
Exactly. So I don't do that anymore. I'll make it every now and then, because you better believe my kids do, like when I make some rice with gandules, they love it. But I just space it out a little bit and not make it the normal. So, that's just kind of how I do it. But yeah, you just got to get a little bit creative. You know what meals that your family does usually gravitate to and what they like. There's always a better option, a way to spice those things up.
Do you, I'm sorry, Alex, do you get to, do you meal prep a lot, or is that helpful with this?
Yeah. Oh yeah, girl. When you're busy, the whole work-life balance is like my jam. And when you're busy and you're running around and you want to have stuff that you want to have it laid out where you don't have to think about it too much, because when we start to think about things, that's when we start to make decisions we shouldn't be making, because we're overthinking it. So I like to just plan it out a week ahead of time. And I just use like paper and pencil a lot of the time. I don't get super fancy with things, but you can obviously, but I just look at it a week ahead of time, and I kind of consider where everybody's going to be at and what we got going on. And am I actually going to be able to like sit down and make a full meal, or do I need to have stuff where the kids can just grab it and put it together, whatever, that they can make for their younger brother, just easy stuff. And so I'm always, planning out the meals, and I just try to keep it simple. I don't try to make things super fancy, because nobody's got time for that. Nobody got money for that. So we just keep it easy. And I list out what I'm going to make. And then at the bottom of like this meal planning system that I have, at the bottom, I have a part where you plan for the next day. So if you got to take out meat, or if you want to do something special, whatever, you got to get ready, then you can get ready for the next day. And if you don't like something you got for one day, you can just scoot it to another day and scoot that meal and put it another day. It helps with the grocery shopping. I don't really go to the grocery store. I get stuff delivered because that's another great time saving thing and helps you just get what you need to get. And I just have it ordered and do it that way. So there's all kinds of different tips that I use, but meal prepping, I don't do like your traditional meal prepping where you put everything in a box and it's all set to go. Because in reality, that really doesn't work for families, for working moms and families. It doesn't work. So just trying to put like the bulk of like your meal together and then having people just warm up their sides and just thinking about things that could have different parts that you can put together and mix and match throughout the week is the easiest way to meal prep that I've come across that I use on the daily. So
I will say that too. With the grocery shopping, I don't really go to the grocery store, and you know how much money I save when I'm not walking down every aisle picking stuff up. It makes a huge difference.
Awesome tips, guys. Amazing stuff, guys. I hope the watchers out there and viewers are writing this down. Of course, they can always revert back to the YouTube video for these awesome tips. But I wanted to chime in really quickly because I wanted, for time's sake, I wanted to find out. And Alex, you've been getting some comments on here, by the way. Shout out to Jared Brown with the Warriors Quest Show, guys. Go check out his YouTube channel. The Warriors Quest Show, subscribe to it. Jared says that you have a great smile. Of course, Shane Blanchard's talking about your smile too, and that you're a natural leader. And I definitely agree. Jared here was saying that a smile goes a long way. So shout out to Jared for his comment. But you've mentioned it, in your tips. You were talking about the word spice, and I wanted to find out, you started something called Spice. So for our viewers out there that want to know what Spice is all about, why don't you tell us about what Spice is about and why you started that?
Oh, yes, what Spice is about. Yeah, so Spice is kind of like going back to holistic health and wellness. I had always had a huge interest in it kind of growing up, and it's really a play on the dimensions of wellness that we have within us. So looking at that, so the S is for spirit, for your spirituality, and the P is for the physical part of you. The I is for the insight, and the C is for the career, because our careers are a huge part of our lives, right? What we're doing, how we're making a living, how we're supporting our families, and how we gain a lot of self-confidence in what we're doing and putting out into the world. And then E is for our emotional health. So I took those SPICE, and that's how I came up with Spice. And that's what I really kind of built my practice around, is helping to support people in all those areas of their life, because I felt like if you could really tame and balance, and because work-life balance is huge thing that I'm all about. If you can really balance all those areas of your life, you can really be successful at anything that you want to do in your life. Because I know for myself, it's true. Like, I'm living proof of it. Like, you can, and it just takes a little bit of work, and I did all the work for people. So that's why I put the program together. So that way I can really help them get the results in all of those areas that they want to have. And sometimes people need a little bit more help in the physical area. Some people need more help in the emotional area. But as a whole, I have found through the whole time I've been doing this, it's all of those different layers play a huge part. And so we really need to support the health and support people in all those areas. So that's really why I developed Spice. And I have individual programs where I work with people one-on-one. I have group programs, because being in a group is super magical, and you harness all that super magical group power together, and you have all that teamwork and that accountability. And when you got another person watching you, it pushes you a little bit harder. So I have group work that I do, and I'd love to, my big picture is to be more involved with like healthcare organizations and bigger organizations, and really work with teams of people and their whole groups of employees, especially now with COVID. I mean, it's so crazy, and staff is getting burnout and leaving. And I really want to try to support all of our fellow healthcare workers to get through this time together. So that's really what Spice is and why I created it. And I mean, I live it, and I talk about it all the time, and I just love it so much.
Yeah. No, it sounds awesome. I've actually was wondering about it. Of course, I follow you on social media and stuff.
Mhm.
So I was just wondering, and I wanted to give our viewers a chance to, get the details on it because, you'd mentioned it and I've got it on the poster, but it sounds amazing. And I love the ideal of it. And real quickly, Victoria, you got some fans too. They're saying that you have a beautiful smile as well. So shout,
Thank you.
shout out to Kyle and they said that my smile needs some work. So I don't know. I guess maybe they're talking about my teeth or something. I don't know. But anyway, I know who that is, but he lives in Canada, so I have to go hunt him down. But anyway, Shane Blanchard says you have a, beautiful soul and a huge heart. So, and Jared's clowning on my hair tonight. He says that he'd like to see me with some long rocks tire hair. So Jared, in the 80s, I had a mullet. I'll have to share that picture with you. So sometime I had the short hair, the short spiky hair on the top with the curly mullet in the back. So I'll have to share that with you one day. But you know what? You'll probably put it on Facebook or something. So maybe I won't
Jared
share
would.
that
He
with
probably would share it.
No, but Spice sounds incredible, and especially you mentioned like during COVID, and with the burnout because of so many patients coming in, and
Mhm.
and then they're seeing an incredibly amount of lot of deaths daily and things like that. So it could be overwhelming, I'm sure, especially working in the ICU
In
and
the health.
seeing a lot of effects of like death and then dealing with the on the normal of like kidney disease and kidney
Mhm.
failure. We had mentioned that at the beginning. You actually work in the ICU with kidney patients that come in and have to have dialysis and all that while they're in the ICU. So talk a little bit about that.
Yeah, yeah, definitely. And kind of the scary thing with COVID is that we've been getting younger and younger patients coming in and like full blown kidney failure on emergent dialysis. Like it's unreal. We never used to have it that much. And now, like, we're getting 20-year-olds, 30-year-olds, 40-year-olds. Like, we really didn't used to get that age of patients. And it's like every other room now is like a dialysis patient or they're on ECMO or they're on Impella, like they're on like all the machines that you need to like keep people alive when they are seriously ill, like critically seriously ill. And it's really is a team effort because you're still the nurse, you're still the bedside nurse for that patient, even though they might be undergoing dialysis and they're undergoing dialysis right there in the ICU room. So, the tech brings all of their equipment up and the nurse is sitting up in there. And so you really have to work with them and I have to get my stuff done that I need to get done, but I still need to be respectful of the dialysis nurse and what she's got to get done. So really working with them closely. And then I got this patient that I got to consider too. And it's like, I got to do what's best for them because you guys know you are just exhausted. You're drained, you know, it's so much all day long, all the time, nonstop. And so I really work hard personally in my practice when I'm working to give my patients rest and to give them space, privacy, because there's like no privacy, right? When you're a patient there. So I really try to work really hard to do that when I'm working as the bedside nurse. But, especially if they have dialysis and stuff, I'm just really careful about trying to get everything done that I can for that patient while I'm in there with them and working with the dialysis nurse that's in there too. And it's just they're they're a different type of patient because you have to be really mindful of so many of all the lab work is really like the key. It's like all based on your guys' numbers. Everything we do, all the meds, all the drips, anything that I'm going to give you, I've got to take into consideration what are their numbers? What are their kidneys doing or not doing? So that's really a huge part of it. And I just know also taking care of dialysis patients, it's educating the patient, taking care of the patient, but then it's also the family member that's there seeing their loved one in the bed, hooked up to all the machines, all the things, knowing that they're going to have to go home with this stuff, a version of this stuff. And it's like preparing that person that probably doesn't have any healthcare experience at all. Never thought that this would ever happen to them in a million years. Never thought their wife or their husband, their boyfriend, girlfriend would be laying in that bed, and now all of a sudden they're going to have to take care of them when they go home. So
Yeah.
doing the family caregiver education is a whole nother part of what all nurses do. We have to educate patients, but we also educate family members, and so that's a huge part of what we do.
Yeah, everything you're saying exactly. That's exactly what happened to me.
You're gonna make me cry.
Um,
Oh yeah. You
Yeah.
you really are. You are an absolutely amazing person. I've met a million wonderful nurses, and it takes such a special person to not only deal with the stress of being in the healthcare profession, but also to see other people, to have the heart to watch other people go through that and be willing to help them, and they're not even close to you or related to you or your own family, and to see what we as the patient and what our loved ones are going through, and to acknowledge it's absolutely incredible. And you have an absolutely amazing heart, and I thank you on behalf of all of your patients. Thank you for everything that you're doing.
Oh, thank you so much. I really appreciate hearing that. Thank you.
Yeah, it's amazing. It's amazing what you're doing, and like I said, everything that you said, that was exactly what happened to me. I was in an emergency case, and kidney disease hit me like a truck, literally. And if it wasn't for nurses that really cared about their job, and really helped me along the way with, like you said, education. Education is definitely key. Of course, if you make it to the ICU, prevention, that's something that you should have already learned, was prevention. But unfortunately for some of us, we had to learn the hard way and go the hard route. And that's what happened to me was, I went the hard route. And thankfully I had some really strong nurses, that really helped me along the way, inside of the, not only at my local hospital, but in San Antonio, when I made it there, and then all the way through dialysis and transplant. I mean, I've had some incredible nurses, and so like Victoria said, though, thank you. Thank you will never be enough, but that's the only way I can express it to you is as thank you for everything that you're doing in the community. It's awesome, and keep going, and keep dropping the spice. Keep shaking the spice everywhere you go.
Right.
So,
I love that.
I do have a question also, Alex.
Yeah.
So you were talking about how you were experiencing kidney failure, and now you are also working with kidney patients in the ICU. Which came first? Did you go through this and then decide that was the route you wanted to go with your career, or did that just happen to happen and you were already in that situation?
You know what? I'm like very like blunt when I talk about stuff, and I had been like punishing my body for years and years, girl, years and years and years, punishing my body and not paying attention to the signs. And even though I was a nurse, something was like blocking me. There was like resistance there to like fully like acknowledge that I was not making good choices for myself. And it was always there, but like I said, there was like that resistance, but it was blocking me. And it really took that whole awakening that I had with the heart failure to really like snap me and like, girl, get your shit together. That's what really hit me. Even though I had taken care of patients like that were kidney patients and heart patients and overweight patients and with high blood pressure and all the things that I had, like I said, there was just something there that was blocking me from making a different choice for myself until that happened to me. And now that I'm there, now that I've like kind of crossed over to the other side and I'm doing things differently now, I approach the way that I take care of my patients so much differently now. And I approach it more of, I know what you're missing. You're missing this education part. You're missing this support part. You're like, all we've been doing for years and years is just giving people pills and giving people quick fixes. And I feel like, what am I doing with all these hours that I'm spending with these patients? Like, I need to be doing more for them. I need to be adding spice to to what I'm doing when I'm practicing with them. And so that's why, like, I've totally changed my whole process of how I'm caring for patients. And now that I'm teaching nurses, this is all the stuff that I'm teaching them now, because I want to see a different generation of nurses coming up that are looking at patients differently, not how like I was taught, how it needs to be, where we need to be educating these patients and these family members so that they're not coming back with these same problems over and over again, that we can really make a real difference in their lives and not just give it a quick fix. So it took me that hard thing to get over, and had that horrible thing happen to me, to finally cross over to that other side. But I'm so glad, things don't happen for coincidence. There's always a reason why things happen. There's always a purpose behind it. And that just was what happened to me. And now I'm on the other side, and this is what I'm meant to do, guys, right? It's the thing. And so that's what I'm really doing right now. And there's no resistance. There's nothing blocking me now. I just go for it. And I just tell my patients how it is. And I try to give them every single opportunity that I can and every resource that I can, so that they can make some real changes. And the family members too, I tell them the same thing. Like, I educate, and I try to help them out as much as I can while they're there with me, because I know I only have a limited amount of time sometimes with them. So that's just what I've been trying to do now. So I'm glad that I do it differently now, for sure. And this is how healthcare really needs to change, and needs to change.
Awesome.
Absolutely.
Awesome stuff. Hey, shout out to Steve, the kidney nurse, Steve Belcher in the
Yes.
house. Yeah, I appreciate him watching tonight. And tomorrow night, tune into his YouTube channel. He's going to have James Fabian from Dad Vice TV from YouTube. He'll have him on there, and they'll be talking and doing an interview. So go check that out on his YouTube channel tomorrow night. I believe it's Wednesday. Steve, what time is that? Hopefully he'll drop a comment what time that's going to be, but that's going to be an incredible interview. So guys, y'all definitely want to check that out. And man, this has been an incredible interview. I'm going to change this up to where everybody can see me talking. So I definitely appreciate Alex for coming on tonight. This has been a very informative interview, and man, it's just been awesome. And if you haven't gotten anything from this, well, you haven't been listening, because there's been a lot of good tips dropped in here, and amazing. Okay, 7 p.m. tomorrow night, guys. Go tune into that. It's going to be an amazing interview with James Fabian from Dad Vice TV with Steve, the kidney nurse, over on YouTube. So go check that out, guys. But this has been an awesome interview, and I definitely appreciate Victoria West for coming on and co-hosting with us tonight.
Always
It's
a
been
pleasure,
amazing.
Jonathan.
Yeah, it's always a pleasure to have you too, and you asked some great questions, and
Thank you.
I really appreciate you coming on and doing it. And before we go, I always like to leave these shows with a message of hope, because the show's about hope with Jonathan. So maybe somebody out there that's been newly diagnosed, or maybe they're on dialysis, or maybe they're on that transplant list and they've been waiting a while, or maybe they just been hit like I did by kidney disease and they're laying in the ICU. I would like for one of us to leave some sort of word of encouragement for someone, to let them know that there is hope. And so I guess we'll go ahead and start with Victoria. If you have anything that you would like to send out to somebody.
I always have something to say.
Absolutely.
I have met so many people like you, who were kind of hit with this out of the blue, like me, who've been dealing with it for a very long time. And at times you get to the point that you just want to give up, and you don't know if you can keep going or if you can keep living this life. But let me tell you that once you find your why, like Jonathan and Jared and all of them say, once you find your why, it comes so much easier. And it's hard, it's difficult. You want to give it up, and sometimes you just want to break down, but you just have to keep pushing. You have to, because like my friend Tomas says, no, you never know who your story might inspire.
Exactly.
What you overcome, what you do, what you put into your life, and what you share with others could inspire the next person. And I've been there. I've wanted to give up, and I've met people like Jonathan, like Jared, and seeing their stories and sharing my own story gives me inspiration, and seeing other people going through this really, really difficult situation makes me feel like maybe what I went through wasn't as bad as I thought it was, and that other people are doing it too, and I'm not alone in this. So just keep pushing and look for that community, because we are like a family. The kidney community is a family, and we are always here to support and always here to talk about what you're going through and what we're going through as the patient and as a family.
That's beautiful, Victoria. Appreciate that. That's a great message.
Awesome.
And like you said, we're a great big family, and never give up on hope. Never give up. It's awesome. That's an awesome message. So, Alex, what do you have for them for the end of the show?
It really, to piggyback off of what Victoria said, and it's something that I actually was recently just talking about on one of my videos, was, don't isolate yourself. Don't feel like you are the only one going through what you're going through, because I can guarantee you there are so many other people going through exactly what you're going through, that are feeling what you're feeling, that feel like nobody understands what they're going through or what is happening, and you're not alone. Don't isolate yourself. There is such a huge community of people around you, and you just have to reach out and just do a simple YouTube search, and you'll find great people like this to connect with, and unlimited resources, unlimited support. It's right there. So don't feel like you need to live in isolation. Don't isolate yourself. Don't shut yourself down, shut yourself out, shut yourself off. Connect, reach out, because there are people that know what you're going through, that can relate to you, and that will support you, and that will be there to listen to you, because sometimes it's all we really need is just somebody to listen to us and to hear us. And I think you guys are offering such a great support system and such a great service with what you guys are doing. It's amazing. So thank you.
Awesome. I just want to say, never let hope become a memory. Just keep believing in hope. And I don't know why I feel like sharing this, but reach out to your support systems. Like, support is so crucial. Whether it's if it's not family, then it's your friends, and if it's not your friends, then it's your community center. If it's not your community center, then it's your church, or it's somewhere. You got to find some support somewhere, right? Because support is crucial. And so don't do this alone. Hang on to hope, but don't do this alone. Like, you got to find somebody that you can talk to, because you're going to have some down days. You're going to have some bad days, some bumps in the road, and you're going to need somebody to talk to. So definitely hang on to support. Find you somewhere, some sort of support, whether it's a support group. Reach out to me. If you don't have a support group, or you don't have somebody, you can reach out to me. You can reach out to Victoria, reach out to Alex, and we'll direct you in the right path, and we'll get you in the right direction. Find you a group of people. And again, I'm Jonathan Traylor, host of Hope with Jonathan podcast. And guys, I'll have all the links, a description for what Alex was talking about with Spice, and what she's doing in the kidney space. And definitely want to send a special shout out to all of our supporters, everyone that watched the show tonight. Man, sometimes I'm in awe of the support that I'm getting for the show, so definitely appreciate it. And again, special thank you to Alex for coming on doing the show, Victoria West. And hey guys, we're going to sign off for now, but look for us next week. We'll be having Emmett Henderson with the Male Lupus Warriors. He'll be on the show, so y'all need to check it out. All the Lupus Warriors out there, come over and check out Hope with Jonathan next week. But God bless you guys. Stay safe out there, and remember to take care of your kidneys. This is Jonathan. We're going to sign off for now.